I think the idea for Changing Lives came from our voluntary sector partners, who are much better than we are at looking at how you create solutions for people that are outside some of the what are fairly artificial boundaries and structures that we build as local authorities. So Changing Lives is about building on what communities can offer, is putting the individual at the absolute centre of our thinking and building around what people can offer rather than necessarily what they need.
And certainly in the last year in the work that I've done and the opportunities I've had to meet with the volunteer sector, they very much opened my eyes to a different way of thinking about patients, and this opportunity to allow patients to be more empowered and more independent, I think is very much the ethos of volunteering, and which we can learn a lot from in health, that we could start to encourage our patients to think that way.
It is putting back something into your community and where you've either been born or brought up or lived for a period of time, and it's about saying thank you to your fellow residents, you know, and helping them in any way you can, and it's as simple as that.
My name is Angie Harris. I am co-founder and volunteer of the Launceston Memory Cafe. We started it in October 2007 because we had both cared individually for family members with dementia and had nowhere to go to talk to people. So the Memory Cafe was born. The Memory Cafe, and the Launceston one was the first one in Cornwall, is here to provide a social angle to people's lives, carers and people who live with dementia. It's a very isolating existence. So we started this, and we try to make it fun for people. Somewhere they can come and relax and do maybe experience things that they wouldn't do otherwise. I have met so many lovely people during the time I've been doing this, and it's very rewarding to be able to give something to somebody that is really appreciated.
With complex systems, it's about understanding that you can't see what succeeded until it's happened, so it's retrospective, you can't plan it, and that is exciting because what it allows you to do is identify new ways of improving things from what emerges from the interactions. So it's not about planning things that to the 8th degree, which we seem to have liked over the last 50 years, but saying, right, okay, what are the outcomes we're trying to achieve? Who are the key agents within that system, and how do we get them to work in a different way? Perhaps fuzzing some of the boundaries between disciplines and between individual and community and between profession as well. So it's about being a bit more creative about what we're doing.
I think the only barriers that there could be are when people want to make this into to fit within professional structures, and we absolutely need to make sure that we don't do that. If we do that, then we take out some of the goodwill and some of the very creative and different ways of working, so we need to make sure that we don't do that.
That means us thinking about more in the way of a more holistic approach, I think, which has always been the ideal, but sometimes time limitations mean that that's difficult to do. But we're thinking more about having a look around homes, particularly things like falls and in the frail elderly, ways of helping to look at opportunities for prevention.
Who feels that they've improved in their abilities since they've been coming to these classes?
Yeah. I've only been here a few weeks and I've improved.
Excellent, okay. Well, my name's Mark Howells. The class I'm doing here today is run by Age UK Cornwall for the practice here at Carnan Downs. We're here today doing an exercise programme that is specifically designed to hopefully either help people prevent them falling in the first place, or if they do suffer a fall, we give them the skills and the knowledge that will hopefully enable them to get off the floor more easily than they've ever been able to get off before. All the people that are here have been referred into the scheme by the local GP services because they've been highlighted as either being either have had a fall, are at risk of falls, or they have a fear of falling and a feeling of being unsteady on their feet.
I think most people want to lead as a positive, independent life as they possibly can, to feel that they're part of a community, that they're making a contribution to society. And they, obviously as we all get older, we might need a bit of help to enable us to do that. Could be that we need help to get outside home, we might have some physical issues, or we might just not know what's available to us if we've moved home or our families moved away. We might not know how we can get involved in the community or continue to be involved in the community. So I think that all of the people involved in changing lives are able to help older people understand that they still can make a valuable contribution, that they're still a key part of their family and their community, and just enable them to do that.
Where you want to end up is where people have a better well-being, and also about where people are recognising that they're part of the system. I think too often we've had professions and functions who think it's their system and then they intervene in people's lives or community lives. This is about saying actually we're all part of the system, and how do we change the approach we have together. And it's a big challenge. It's developing a new community of practice between a professional in the voluntary sector, professional in the public sector, and the individual themselves within the community. So it's no longer treating people as passive recipients or problems. Actually, they're part of the solution.
My name's Terry Stanton. I am the manager for the Viva project. Viva stands for Volunteering in Vulnerable Adults. Viva is a partnership between Volunteer Cornwall, who I work for, and the Department of Adult Care and Support from Cornwall Council. Viva clients have the same opportunities as any other person within the community. It's just that we provide that little bit extra support to enable that to happen. And boy, once it does happen, they get involved in all sorts.
I wanted to volunteer because I thought that it would be a good opportunity for me to help other people, as quite often people are helping me because of my disability. So I thought I'd be able to give back to the community and at the same time help somebody else to reach their goals.
Viva has helped me because not long after I started becoming a volunteer driver, I got offered my first job. So I now deliver bread in the mornings, and then from the rest of the day I do volunteer work.
I think that there's a big debate, well there is a huge debate on in Parliament at the moment, about how we can make the sum greater than the individual parts in terms of the way that we look at public services and taxpayer money to support our ageing population. And I'm very much involved in debates around adapting to demographic changes, to providing better services for older people, their carers and their family. And this struck me as an absolutely ideal model that we should be looking at a national level.
I'm doing some work at the moment with our local library and within my local home community to set up a memory cafe for people with memory loss. So it's great, and it gives me so much back, really recharges the batteries.
I volunteer for two major organisations in Loo, and one's the Harbour Commissioners and one's a Loo Development Trust. People that volunteer don't get just, okay, I've done my bit for society. It's about what you leave behind you, and I think that's the most important thing about volunteering. It's not what you do today, it's what you leave for tomorrow.
I mean, I have done a lot of voluntary work before I got elected into Parliament, and I do think that volunteers do bring something special, because this isn't to take away anything from social workers or from healthcare professionals, but people know it's their job. But they know if a volunteer is sitting talking to them that they choose to be there, and they're giving up something that's very precious to all of us, which is time. And I think that's what makes it so special, that somebody knows that they don't have to be there, they want to be there.
I see day to day the benefits that volunteering not only brings to the recipients who meet with the volunteers, but also to the volunteers themselves. And I think it's one of those really fantastic opportunities that presents in life where we can really feel part of a bigger picture and a supportive society.